It has been called one of the worst possible pains. For some people, it is so bad it's triggered suicides. So today we're getting some medical answers on what's behind cluster headaches, what causes them, and how to treat them. With more on this is local neurologist and pain management expert Dr. Chad Domingue with the Avila Physician Network. Thank you so much for joining us on this.
Good afternoon. Yeah, just a personal story. When I was in South Carolina, I had a veteran patient at the VA that actually committed suicide from cluster headaches. So, very difficult disease, and I saw it firsthand what it could do to somebody.
Yeah, I imagine that would be just intolerable to deal with that on a daily basis. So, exactly what are cluster headaches?
Cluster is very weird. It's a very rare syndrome. And we talk about migraines all the time, is what most people know. But cluster is kind of the ugly cousin of migraines. Migraine patients want to hide in a corner, turn the lights off, stay away from me. Cluster patients are literally beating their head against the wall. They literally want to stab their eye because the pain is so severe. It's one side of your face, it's around your eye, it's a throbbing type pain, and it activates a different part of the nervous system where they get teary eyes, droopy eyes, swelling, and it's just really severe. The cluster aspect of it is it happens over multiple hours and multiple days, and it's really cool because it happens certain times of the year, and then it goes away for a while. And you can't predict when it's going to happen. You can't predict why it does this, but it's just really, from a neurologic perspective, this really unusual disease process.
Are there some people who are more vulnerable? I mean, who usually gets this?
So, unlike migraine, this is more common in men. Migraine, obviously, being much more common in females due to the hormonal aspect of it. It's usually younger guys, early 30s, late 20s that get this. It's not always a genetic history, it's sometimes out of the blue. There's certain risk factors: bright lights, noise, cigarettes, alcohol, kind of similar to migraine patients. Just to show some anatomy, I got my trusty brain here.
Hmm.
The abnormality for cluster is in the inside portion of the brain called the hypothalamus. And there's an abnormality with serotonin and histamine, and that abnormality causes an activation of the trigeminal nerve, which is a nerve that comes to our face. And that's why they get this one-sided pain and the droopy eyes and all these type of things. Again, what causes the abnormality? Why do they have it? We just don't know.
Wow, that is just awful. So, how is it diagnosed? How is it treated?
Cluster headaches is one of those things when you see it, you never forget it. But you always want to rule out everything first. When I see patients like this, I do an extensive neurologic workup, MRI of their brain, look at the blood vessels in their brain. So I'm ruling out vascular abnormalities, tumors, multiple sclerosis, things like that. But at the end of the day, again, it's a clinical diagnosis. Once you feel confident they have this, the treatment is probably similar to what we see in migraine. You take anti-seizure medicines such as Topamax, Depakote. You can use the injectables such as Imitrex, Triptans, Relpax. The thing is cool about cluster headaches, it's exquisitely sensitive to oxygen. Why is that? We don't know. We suspect that by taking in oxygen, you're decreasing the blood flow to the brain, but oxygen doesn't have the same effect on migraine, so it's really unusual. There are some procedures, occipital nerve blocks. There's a ganglion inside your mouth called a sphenopalatine ganglion you can block. So those are options. I actually did some research where I incorporated spinal cord stimulators. So I
Hmm.
implanted electrical devices for people with this disease process. You can also do a vagal nerve stimulator. But again, this is a very difficult disease process. And, one of the patients I did this device on, it literally saved his life. He was in such severe pain, 20 ER visits a month, that once he got this device, it was really, groundbreaking for him.
So, the message is if you're suffering from these symptoms and they're most likely cluster headaches, check with your doctor, see what the options are to permanently try to fix this.
Yeah, check with your doctor. Don't give up. I mean, cluster's not common, so sometimes you have to, get around to multiple physicians to find someone to find exact disease process and treatment. But you can't give up. I mean, these are very difficult patients, and they need to be
Yeah.
reassured and taken serious.
Thank you so much, Dr. Chad Domingue. Appreciate it.
Absolutely, always a pleasure.